what do we do to try to prevent injury? So a couple points that I put up here. Of course, there's a lot of different things, and it's very individual to everyone, but just some of the basics is proper warm-ups. That's very important before doing any heavy lifting. A lot of times we try to rush through and we skip that part, but that's probably one of the most important things you can do in a workout. Gradual transition to new exercises. A lot of times there's new classes that we want to take, or there's a new workout that we saw someone do and we kind of want to just get into it. But doing gradual increase and getting there step by step really helps those muscles and tissues get used to it and prevent that irritation from happening. Varying exercise routines is very important. A lot of times we do the same workout over and over and over. If it's shoulder day, we're doing the same exercise. If it's back day, we're doing the same exercises. Over time, that can cause the tissues to, again, get stressed. Those overuse injuries that we talk about. Another thing is that I like to tell people is to challenge the muscles in different ways. There's a lot of different ways that you can do the same kind of exercise. Whether if you're going to add a little bit of stability to it, or you're going to do some eccentric, which is slow lowering, but challenging the muscles a little different ways, making them kind of always be on their toes, helps with developing the muscles in the right way and preventing injuries in the future. Posture is important while sitting or day-to-day activities, but also with exercise. And also working on not just the big muscles, not just the big like lats and deltoids, but also trying to concentrate on the smaller muscles around the shoulder that we talked about, which are the rotator cuff muscles, for example, to prevent injury. And because the rotator cuff muscles are so important to stabilizing the shoulder, a lot of times we ignore them and only concentrate on the big muscles. So rotator cuff health is very important, and that is keeping those little muscles strong, not just working the big muscles, like I said. And there's a lot of different exercises, and usually they involve not heavy weights, very nice and light, and doing rotational type exercises that make those rotator cuff muscles fire. Scapular stability and shoulder blade stability is really important, because your shoulder blade is really the base, it's the foundation of your shoulder. If your shoulder blade is strong, you have a strong base of support. Now your shoulder is going to be more stable, and there's going to be less stress on the other joints of the shoulder, which again will decrease the chance of injury. My general rule of thumb is that when you do any kind of lifting, that you want to have, if you can, your thumbs up. If you have a choice between thumbs up or thumbs this way or thumbs down, especially, you don't want to do, thumbs up is the best, because what that does is allows all the tendons of your rotator cuff to clear through where your acromion is, or your shoulder blade is, and not cause that impingement that we talked about before. So thumbs up is going to be a lot better than having your thumb down, which is going to cause a little bit of pinching and irritation. You see it or you don't, so I'd rather you see it. Not when you do your exercise, I want you to try to see the weights. Whether you're doing a chest press, if you don't see the weight, you're probably going too far and causing a lot of stress just going on your shoulder. Maybe not working your pec as much anymore, as much as you're stressing the anterior capsule. Doing any kind of pulls behind the back, or doing anything where you don't see the weight, a lot of times is for your shoulder, as when it pertains to your shoulder, probably putting too much stress on it. So you see this guy is not seeing the weight. Bad. Anterior shoulder translation. So if you see this guy over here doing a triceps dip, any exercise that involves your shoulder to come forward in the socket, putting a lot of stress on the front of the shoulder, we're talking about the capsule, ligaments, and the rotator cuff that's in the front, can cause a lot of stress to that area. So any exercises that you do that will cause anterior translation of your glenohumeral joint, you have to be very careful, especially if you already have pre-existing shoulder issues in the past. And impingement positions are basically what we talked about before, especially rotating inwards and up, like this exercise, which is pretty common in the gym, but it does expose your shoulder to impingement. And can irritate your shoulder. Posture during exercise is something that we always need to concentrate on. We always want to do the heavier weight or try to, do this whatever exercise we want to do, but we forget about what the rest of our body looks like, and that's very important. The posture that we are in while we're doing exercise is just as important as the exercise that we're doing. So that is basically a quick overview of the shoulder for today. Thank you so much for listening and being here. If does anyone have any questions, I'm here to answer them. Any questions, John?